Hi, Dr. Tracy Tyson, board certified general pediatrician. And I filmed this a few times. I'm going to try to do it without seeming as upset as I really am. But I see this comment a lot on online platforms where people talk about how it shouldn't be mandated that children have wellness exams, that you don't really need them, that it shouldn't be mandated for all of these things. And it really, really infuriates me because when you say things like that, yet you don't take any responsibility for the outcome for the health of that child, it is extremely irresponsible. So when I make a recommendation as a licensed medical provider in the United States, I have to take responsibility for that child when they get sick, when something happens to them. I am legally liable for the health of that child when I make a recommendation. So I cannot make a recommendation because of something I think or a feeling that I have. It has to be based on evidence-based medicine. So let me tell you the real reason why wellness exams are required. That is because not every child has the privilege of being raised in a home where they are taken care of and they have all the resources that they need. I have picked up, and my colleagues have picked up, horrific abuse that you cannot imagine that would not have been picked up if a daycare or school did not require that the child had some kind of physical. I've picked up leukemia, brain tumors, horrible thyroid disorders that was really destroying the child's health, scoliosis that was so bad that they missed the opportunity to have surgery because the parents saw them every day. They had no idea that this was happening. We have seen some of the worst conditions that you have seen, teeth rotting out of the head, parents who need real help with their children and they don't know it, or they're afraid to ask for help, or there are circumstances that are unsafe for the child. And this includes all socioeconomic levels. I've had children who needed someone to talk to about their mental health, but because their family didn't take them to the doctor, they had been cutting for months and no one knew it. There is real consequences to information that you give out when it has to do with public health. And when people put things on the internet that is not true and they don't take responsibility for it, people die and horrible things happen. So unless you are willing to go through the education, the time, the effort, the moral injury, the devastation that medical professionals have to go through to try to keep people healthy and then treat them when they're not healthy, you do not need to be giving this advice. It is dangerous. If you're someone who isn't giving this advice but hears it, please, please, please think twice before you listen to what someone says on the internet that has absolutely no medical training whatsoever. It is destroying public health in this country and worldwide, and we are going to have some serious consequences because of it. Please talk to your medical professionals. Let us know who you're getting your information from. Let us know what you're worried about. We truly are here to help you, and we are the ones that are there in the middle of the night when your child is sick. We're the ones there in the ICU. We're the ones there holding your hand when something goes wrong, and we're there helping your child and somebody else's child when they're not getting what they need, and we have to go home and live with that. So I hope this helps someone, but also please stop making these comments. Thank you.